Injectors, we need to be doing a better job at this. I just wrapped up a full day in the office and I had two patients say this to me today. My first patient was a masseter tox consultation and she had had masseter tox in the past, but I walked her through all the pros and cons. I walked her through potentially hitting the rhizorius and having an asymmetrical smile. I walked her through paradoxical bulging and what we do in the event of that. I talked to her about the potential risk of worsening the appearance of her jowls, but I also talked to her about the upside, jawline slimming effect, the potential improvement in TMJ symptoms. I painted her the entire picture. She told me nobody has ever walked her through the side effects like I did. My second patient was a lip filler patient, had had a long history of lip filler, but she came to me for a fresh pair of eyes. So I walked her through my full spiel. I talked to her about a vascular occlusion and what it is. I talked to her about how we recognize it, and in the event it were to happen, what we are to do in the event that she does experience a vascular occlusion. And she told me that nobody had ever chatted with her about a vascular occlusion. She's never even heard those words. And to me, that blew my mind. Injectors, we need to be walking our patients through all the complications, side effects, and potential risks that they are taking on when agreeing to perform a treatment. All of our treatments have risks. Patients know that, but they need to be educated on what those risks are so that they can make an informed decision for themselves. And I know as injectors, when we first start out, we're terrified of talking about complications for fear that the patient chooses not to treat. In the event they choose not to treat, great. We did our job as an injector and we have a duty to explain to them the full picture. How can they make an informed decision for themselves based on just part of the story, just the upside? We have to be comfortable talking to our patients about the side effects, because I know I can comfortably go to bed that God forbid something were to happen to my patient, they knew the risks that went into these treatments, and I did my job at painting the whole picture, not just the upside. So injectors, please get comfortable at explaining complications to your patients. They know that there's risk, but they need to be informed on all of them, and we need to do a better job at this.